Hi, I'm Jonathan Colopy from Your Y. Thank you for joining us today on the Y Be Well podcast. I'm fortunate to have with me Julie Benn, who is an award-winning journalist and is currently the communications specialist for NAMI San Diego. NAMI is the National Alliance of Mental Illness. And today our focus of conversation is on World Mental Health Day. Julie, thank you for joining me.
Oh, thanks so much for having me, Jonathan. I appreciate it.
So World Mental Health Day, where did that come from? What was the original founding of World Mental Health Day?
Well, from my understanding, World Mental Health Day began back in 1992, and it was really based on efforts by the World Federation for Mental Health. I know that there's the theme right now for 2023 that mental health is a universal human right. I think they have a different theme every year, and it's a universal human right is what we're looking at for this year.
So with that particular focus, what does that mean? That it's a human right? I can definitely appreciate that. But as we bring that forward as the theme, what does that mean in practice?
In practice, that everybody should have, I think, access to mental health. He does
Resources.
resources. We want to be able to protect everyone's mental health as a human right, um, and just like kind of like living and breathing and drinking water. We hope is a human right. Then I think that being able to have access to mental health, good mental health care, and when they say without mental health you have no health, so I think that that really kind of sums up how it is a right for us.
Well, I appreciate really underlining, that mental health is a human right, a universal human right. I appreciate that it's much more of the conversation today, where there is a receptivity to talking about one's mental health, as well as seeking out how to maintain one's mental health. And so, thus, underlining it being a universal human right is a good starting point for the conversation. What are the statistics in terms of one's mental health in the world today?
Well, I looked it up, and 1 in 8 people globally live with mental health conditions. So
Mm.
that's globally. If we take that down to the United States, 1 in 5 adults live with mental illness. 63% of people said that their mental health was poor, according to a survey by Monster. And then we've got 62% of women, 51% of men ages 18 through 34 say they were completely overwhelmed by stress. That's a lot. That's over half of us, according to a poll by Stress in America. So we
Julie,
need, yeah. Go ahead.
how does that compare? I mean, historically, do we have data going back in time and getting a sense, is our mental health improving? Is it the same? Is it a worsening condition?
When I started with NAMI 17 years ago, we would say there was 1 in 4.
Hmm.
A few years later, we changed that to 1 in 5. However, with COVID, with the pandemic, with all the things that have happened, all the things that's going on in the world, I think 1 in 5 may be not as accurate as maybe 1 in 4. I think if we start getting new numbers in, I eventually I think we're going to probably be back to that 1 in 4, but
Okay.
technically 1 in 5 right now.
Okay. And so with the World Mental Health Day, how do we bring forward really honoring mental health being a human right?
Well, just kind of taking it to NAMI is NAMI San Diego and Imperial Counties we have this mission to support and educate and advocate, which is really, I think, helping make a difference with the free services we offer. But first, we believe that it all begins with mental illness, making it okay to talk about mental illness and letting people know they're not alone in this journey. The idea is that if we talk about it, if it's okay to talk about experiencing mental illness, then it's okay to learn about it. And then it's okay to get help. But none of that happens if we don't start the conversation.
It
I
it
mean,
seems it seems like there is uh, more of a willingness to share one's journey. I see that maybe more so true for younger people. But Julie, if you will, share how you came to NAMI.
Sure. I got involved with NAMI 17 years ago when my therapist at the time said, "Hey, it's time for you to start giving back. I want you to get involved with NAMI." And I said, "Okay, great. What's a NAMI? I don't know what a NAMI is." And she said, "It's this great organization. You've got to get involved. They've got a wonderful program called In Our Own Voice, which is where you learn to tell your story. And you go out with another person and it's about an hour-long presentation, and we talk about our dark days. We talk about acceptance, coping skills, and we end with successes, hopes, and dreams." And so she wanted me to really get involved in that program. And when I contacted NAMI, they weren't doing the training yet for that, but they did carve out a little position for me as a communication specialist. And like I said, that was 17 years ago. And, my story basically is I began my own journey with mental illness at a pretty young age. When my parents divorced, my life became the series of multiple long trips between my folks many times a year. I also experienced sexual, physical, and emotional abuse as I was growing up.
Uh,
And I actually had a suicide plan by the time I was in third grade. It
wow.
was just something I could fall back on, in case things got too bad. I just kept it in my back pocket.
Hmm.
By my
Julie,
teen years, yeah, go ahead.
I'm just trying to think. That is real early on
Yeah.
that you were challenged, from a mental health perspective. Was there support in your life at that point in time? Did you feel like you had someone that was there for you, or did you feel like you were mediating life on your own, so to speak?
I felt so alone, Jonathan. It was
Ah,
I was getting on airplanes at 5, 6 years old, going from one side of the country to the next, and I just felt like I didn't have an advocate. I didn't have anyone to kind of champion my journey and my mental health. I felt extremely alone.
hmm. And
And
I apologize. I interrupted you there. It sounded like you're starting to talk about your teen years.
oh yeah, no problem. Yeah, by my teen years, I was kind of overtaken by anorexia nervosa. That's a condition where I starved myself and overexercised almost to the state of oblivion. I knocked on death's doorstep, and doctors told me that my body was almost at the point of no return,
Wow.
where it just cannot recover and organs start to fail and shut down. So I did get into therapy. So this was when I was at age 16. I did have a parent figure tell me that basically threatened me and say, "You're going to therapy and you're going to get help." And
Good.
yeah, so I did. And so, it's good news is I'm alive today,
Yeah.
through a series of therapies and treatment modalities and psychotropic medication over the years. I feel like now I'm living the best life I can with what I've
Mhm.
got. And it's really a process and a journey rather than just a destination.
Julie, thank you for, sharing, your personal story and the journey that you have come along, and to a point where, I'm thankful for you offering your life experience and giving back too to others that are walking maybe a journey that might be similar.
Oh, thank you so much. And I learned over time, probably the most important thing I learned is that I absolutely had to talk about my mental illness if I was to heal. And that's why World Mental Health Day, again, circling back, is so important because we've got to start that conversation and we've got to make it okay. We've got to be able to come alongside each other
Mm.
in this journey. Those of us who have been through it, even those who haven't, we need so much more compassion in the world. And that's really a good part of what NAMI is trying to do is, kind of foster that compassion through our programs and our services. Um,
If
yeah.
you will, what does NAMI do in terms of the array of programs and services? And I know it has a national reach, and it has been around for a period of time. But when you speak of, walking alongside one, what might that look like in terms of programs and services?
Yeah, with our with NAMI San Diego's actually NAMI San Diego and Imperial counties, we've expanded. So we are actually the largest affiliate outside of the headquarters in Washington. We really want to be able to come alongside by offering. We have a helpline. Everything we do is free too, by the way. We have support groups, both for those who experience mental illness and for those that are their loved ones or family. They're separate groups. We have education classes for both peers or people who experience mental illness and for their family members. Again, online, free.
Mm.
We have, gosh, we're publicly honoring some local stigma busting community members and organizations this month at our annual Inspiration Award ceremony on October 26th. And this is a really cool time to look around and see what people are doing in our community to champion mental health, to fight the stigma, and to make it okay to talk about. Our annual walk is in the spring. It's our largest fundraiser, and it's just thousands of us getting together and pounding the pavement for mental health. Plus, we have a great resource fair, again, making it okay to talk about, coming alongside, showing that there is no shame.
Mm. So the helpline, how would someone access that? Is there a certain acronym or a number that is easy to remember?
Yeah, we run a couple different helplines, but the first one, kind of our newest one, is Cal Hope, and that is 833-842 HOPE, HOPE, or 4673 numerically. We also have for most of our information is at namisandiego.org, and that includes our regular information line. But the Cal Hope line is really anybody can use this line. It's very exciting that we have this now, because it's not necessarily a crisis line. However, if people do call in crisis, we can help them and get them over to access a crisis line or the wherever they need to be directed. But you can call with basically any kind of situation. The holidays are coming up. Maybe you're feeling lonely. Maybe you're feeling not included. Maybe there's some seasonal affective stuff going on with the days getting shorter. If you need somebody to talk to, Cal Hope is here, and that's part of NAMI.
That's so important to have that link to know someone's available, as you said, to walk alongside you. And so, if I was to describe it accurately, would it be quote unquote a warm line where you can reach out and have someone who is providing that support and lending an ear to you?
Yes, it is. It is a warm line. And like I said, there are crisis counselors that do work on the line. However, if it goes beyond their capabilities, then they can definitely get you plugged into the right, either program or the right number. As we know, 988 is the National Suicide Prevention line number now. We also have in San Diego mobile crisis response teams, which is a really cool thing that's kind of utilizing the peer movement, which is basically we do peer training for folks who have lived mental health experience, and they're using peers in a number of ways. For example, the mobile crisis response team, MCRT, is a clinician and a peer that go out in a psychiatric emergency or a psychiatric, somebody's in crisis, but it doesn't need to involve the police. It's been
Yeah.
determined that it doesn't need to involve the police. And so this team goes out and they can really help people. And people really like talking to the peers,
Mm.
sometimes more than the clinicians, because they've been there. They
Yeah.
know what it's like,
Yeah.
and they know how to help people through it. And again, that just goes back to what we're all about.
That's such an important model, that peer support, that lived experience that someone can share. And as I understand, the mobile crisis response team is a newer avenue available in the community. It just seems like it has provided support, whereas emergency services such as the police or fire department would often be called. This is providing someone who is specifically trained in or experienced in mental health issues.
Yes, absolutely. And it's fairly new. You're right. I think within the last couple years, it's come to the forefront. So I think it's a great service. Again, utilizing the peers as much as we can. NAMI also offers a peer support specialist training. It's a free training, and it's done online. And this we were just got approved to have, like, people can take this training and then test to be able to, it's the state test to be able to be covered by Medi-Cal. And so these services are starting to be recognized as important. They're starting to be covered by insurance. And this is just a great opportunity for people who want to give back, have lived experience, either with themselves or their family members or friends, um, and want to make a difference. And without having to go all the way through school and become a psychologist or social worker, this is still another really good way to help.
Well, Julie, you've highlighted really critical interventions that are available through NAMI and in the community. Because everything that I read about is just really the overwhelm of the professional mental health system and the lack of clinicians.
Right.
Thus, how important it is to have these interventions available. So, thank you for highlighting that. If I could, Julie, if there was a particular call to action on World Mental Health Day, what might that be?
I I kind of sound like a broken record, but again, talking, talking about it, sharing your story, remembering that there's no shame with this.
Mm,
This is a mental disorder is nothing to be ashamed of. It's just something that happens. We happen to have it. Like, sometimes people get cancer, or they have high blood pressure, or they have some other situation that they have to manage for the rest of their lives somehow. Um, that's what it is, and it's. I used to kind of be in the closet before I started working for NAMI about my mental health and my journey. And NAMI really, when I say I work for the National Alliance on Mental Illness, it really kind of busts those stigmas and gets me out of that closet, and it encourages me to share. And I've been able to do hundreds of talks and speeches over my
um,
17 years. And I always said, if I could just even make a difference in one person's life, this has
yeah.
all been worth it.
Um, well, Julie, thank you for the important work that you're doing and the platform that you're standing upon to share your story and to connect with others, and the difference you're making in communities. So, Julie, thank you so much for sharing the resources and sharing your story today. And thank you for the work you do.
Thank you so much, Jonathan. I really appreciate your time and having me on.
And listeners, until we're together again, please be well. Thank you.